My name is Andrew Cheyne. I am Director of Government Affairs for the California Association of Food Banks. Thank you so much for having me on and allowing me to give a brief overview of who we are, what we do, and how we can work more closely together to keep California well-fed, healthy, and just survive through this crisis. I appreciate all of the existing partnerships. We were so glad to have Lucy from CPCA at our annual member meeting last summer, as well as participating in the Social Determinants of Health working group. Just a brief overview of the California Association of Food Banks. So I and my team work on our policy and advocacy priorities from the county, state, and federal level, and a key emphasis of ours is hunger as a social determinant of health. But one of the things I like best about CAFB is that we are really multifaceted. So we also have a team that operates our Farm to Family program. They work to recover approximately I'm proud to be a part of a team that's truly multifaceted. We also have our Farm to Family program, the nation's largest food recovery program that reaches across farms nearly 175 million pounds of fresh produce every year, as well as non-produce items. We also have one of the largest CalFresh outreach networks in the state, working with more than 60 partners to enroll low-income Californians onto the CalFresh program. And we also provide member services. Particular focus is on disaster preparedness and supporting our rural and remote food banks. I'll talk about them more in just a moment. So that was a little bit about the California Association of Food Banks, but now our members. As you can see, we have 41 member food banks who operate all the way from Oregon to the Mexican borders. Those food banks in turn, however, work with 6,000 local agencies. And there are, in our parlance, only 41 food banks who are the regional county-wide organizations that are essentially the warehouse, the hubs, if you will, but there are more than 6,000 local spokes. So you may be familiar with an organization that might call itself a food bank. They're doing incredibly important work, but just so you understand our perspective on the lay of the land, there are 41 food banks in our association, a couple of independents who are not our members, but many, many more local groups who are actually handing food out to people every day. I want to assure everyone that during the COVID crisis, food banks are well supplied and open. Of course, if you've been shopping, you may have seen empty shelves. There's obviously been disruptions, but the food banks are open, and we are working around the clock to make sure that that continues. There have been significant changes at that local level among our 6,000 agency partners. One of the biggest issues has been a significant decline in volunteers. And you may have seen on social media the significant partnership by Cal Volunteers, the First Partner, and others to try and assure that we have significant volunteers and can sustain those local operations. As well, food banks have opened up a variety of new distributions. You may have seen news coverage, for example, of drive-thrus, massive operations in Orange County, in Sonoma County, Alameda, really across the state in trying to develop innovations to ensure that we're able to meet people in convenient locations, as well as maintain social distance. Obviously, not everyone has a car, but just as an example of the type of work that's going on to try and ensure that we keep staff, volunteers, and the people we serve safe. I will have contact information at the end of the presentation so you can make direct contact with your food bank as well as those local partners, and we appreciate everyone's interest in those partnerships. Next slide, please. So as you can see, we're using first responder here language, and I'll talk about these images in a moment, but just to pause and really help explain how this is different. So California food banks are no stranger to disaster, and obviously nor are all of you in the clinics. But in a fire or other natural disaster, food banks think of themselves as second responders, those who move in after emergency personnel have made things safe, and much like clinics, serving the community long after those emergencies are over, but the need for services remains. In the COVID-19 pandemic, however, just as clinics are on the front lines of that pandemic, food banks are on the front lines trying to prevent a secondary public health crisis of hunger. I'm sure I'm preaching to the choir here, but UCSF and other data have proven that hospitalizations spike at the end of the month. And so again, while trying to uphold social distance and effective public health practice, food banks really are on the front lines trying to make sure that we don't have an increase in the need for healthcare utilization at a time in which we're all trying to prevent potential system overwhelm. So just to walk you through what some of these pictures are that show what's going on in the field. So on the left, we're looking at a distribution by the San Francisco Marin Food Bank. We're also seeing the National Guard at the Find Food Bank in Indio, California, in eastern Riverside County, the Coachella Valley. As I spoke to earlier, we've had significant decrease in volunteers and also staff. I'm sure similar to clinics, there are people whose children are at home from school or older adults on staff who now need to stay home out of an abundance of caution. Others who may be immunocompromised. And so there are National Guard on a humanitarian mission to support food banks in the warehouses by driving trucks, operating forklifts, or providing other logistical support, and we're incredibly grateful for their presence to sustain our mission. You can also see some of the precautions we're taking in the top left-hand picture at the SF Marin Food Bank in terms of trying to make sure that all of the staff and volunteers themselves are staying safe and healthy. In the middle is a picture of the innovative new disaster box program that the California Association of Food Banks has stood up. We were tasked by the California Department of Social Services, and it's truly government at its finest, in which within days of the shelter-in-place orders and the realization of how significant the need for food would be, that they worked with us to find a supplier and begin pulling trucks of the packaged shelf-stable foods across the state to make sure that not only do we have adequate food supply, but to minimize the burden who are down staff and volunteers, as well as having boxes of food that are ready to be handed out, again, minimizing that contact and upholding social distance. On the right-hand side, we're looking at Second Harvest of Orange County. They served last Saturday nearly 4,000 carloads of people at the Honda Center in Anaheim. That was up from about 2,800 just the week before. So as you might imagine, food banks have seen an absolute surge in the demand for food just at the same time that we've had challenges in terms of volunteers and staff. So truly it is a trying time, but we're so proud of our members for rising up to this challenge and again developing these innovations to try and help better feed the community need. And finally, pre-bagging at the Alameda County Community Food Bank at the bottom right hand. Food banks are pre-bagging everything, again, to make sure that there is minimal contact, upholding social distance, and trying to ensure that the community is fed while upholding public health. So in addition to the surge in demand for food bank food is the explosion in applications for CalFresh. And you may know that food is an early indicator of economic distress. It's been proven in the onset of every recession that the need for food, both measured in food banks and in CalFresh, our food stamps program, that those applications are a sign of that decline in hours, in wages, and lost jobs, unfortunately, that we've all been seeing in the news lately. So here is a snapshot that in some ways is already a little bit out of date, but it really shows the dramatic increase in applications in the getcalfresh.org website, which is the easy, simple-to-use online interface to access the CalFresh or food stamps program in California. I encourage everyone to write down that web URL, getcalfresh.org. It is a highly user-friendly application for the food stamps program, and it's available in multiple languages. There's chat support, and really it's the best way to access the program right now when offices are closed. But just to give you a snapshot of the volume of increase, the chart speaks for itself, but for those of you familiar with the SSI expansion, we have actually exceeded the amount of applications over even that historic expansion of CalFresh just last summer. And in fact, the most recent data show more than 8,000 applications on a single day. Truly incredible as we've seen the program respond to the changing economic conditions. And just for some context, CalFresh serves at least 9 meals to every one provided by food banks. So it really is the best way to keep people healthy and relieve pressure on food banks. Also, CalFresh isn't just food, it's money for food. And so it delivers much needed economic stimulus to try and support our economy during this time. Every $1 billion in CalFresh benefits creates more than 13,000 jobs, particularly in states like California that have high food system economies, making sure that there's people with the money to buy those groceries, supporting our retailers, our truckers, food suppliers, growers and farmers, truly across the food chain. Finally, there are some exciting changes and improvements to the CalFresh program that I want to make sure everyone knows about. First of all, there are emergency allotments. Out of the HR 6201 Families First Act, CalFresh recipients are moved up to the maximum benefit allotment for both March and April benefits. So if you've ever heard about the complaint about someone only receiving $16 a month, that's now $194 a month in March and April. And if someone applies today, their application, even if it takes some days to process, will be registered on April 7th or whatever day that application is filed. And so someone may still be eligible for that increase in CalFresh benefits. So truly, this is a very important time for folks to get onto that program. And I'll talk about that a little bit more on the next slide, please. So how can your clinic help assist low-income Californians access this program? It's important to remember that online is the best way to access the program. All county offices are closed with some very limited exceptions. Obviously, this is for the health and safety of our county employees as well as the low-income people that need to be served. So we encourage everyone to go to getcalfresh.org. And we know that that may be challenging, the online experience. And so we are here to help assist. Again, we are working with over 60 local partners, so please contact Stephanie at her email address there. We have similarly moved our assisters to help people through the application process to phone and online chat support, and we're glad to help. And as I mentioned earlier, there's also online chat support through getcalfresh.org directly. Finally, some good news is that while some of this may be challenging in accessing the program remotely, we have been granted important flexibilities in the application process that should help people move through, allowing people to attest to documentation, allowing flexibilities in the interview, and other important pieces that, again, your CalFresh assisters will be available to help explain and move you through the process. We've gotten many questions about how can people help. So here is your list of best practices to do just that. First, as I mentioned, help everyone understand if they are potentially eligible for CalFresh and assist them to learn more and to apply for those benefits. Now, as I mentioned earlier, is an excellent time to do that given the increase in benefits. Also, schools have become an important hub for grab-and-go meals. You may be aware that the California Department of Education and Superintendent Tony Thurmond have actually mandated that all schools need to provide what are called non-congregate or grab-and-go meals. And so that information is going to vary by district in terms of what time, what location. Truly, it's been a bright spot, and we applaud the leadership of our schools, the districts, the food service workers, and everyone involved trying to make sure that schools, which are obviously accessible, visible, trusted locations, are places for people to pick up food. And in many instances, your food banks are already partnering with schools to provide meals to the entire family. So the family may be able to pick up reimbursable school meals for children and also get groceries to help make sure that no one is going hungry in that household. In addition, contact your local food bank about setting up a food pantry or pop-up or layering on to any existing partnership. We know that many clinics already have temporary distributions or have part-time farmers markets, et cetera. As I mentioned earlier, there's been a lot of changes at the local level across our food banks and our local partners to meet these changing conditions that may apply to you too. So please be in touch with your food bank about the best way to adjust under these circumstances. I will be sharing a URL about local, how to find local food bank options, and we appreciate everyone sharing that information about what are the best places, times, to get that local community food information to your clients as well. Finally, as I showed in the pictures, we hope for your partnership in prioritizing food bank staff and volunteers for COVID testing, personal protective equipment, and all of the cleaning and sanitation supplies to ensure that we are able to continue to fulfill our mission to keep people well fed, to keep them healthy, and preventing everyone from using healthcare services as much as possible while we try and maintain that healthcare space for those who truly need it related to the pandemic. So here is that one-stop URL, cafoodbanks.org/find-food-bank. So please take down this URL and use it, because you can put in a zip code and get very specific information across the state on who your local food bank is and the contact information to start to have these conversations. And when you contact your food bank, you can talk to them not just about which local agencies are the closest, but also any particular populations that you are prioritizing, whether that's children, older adults, people experiencing homelessness, or others. Obviously, food banks are trying to triage a lot of those questions on a real-time basis, and it's best if you contact your local food bank about what that local situation is. I would also imagine that just like the clinics, capacity is stretched and also varies across the state in the food bank network right now. As I mentioned, the community demand for food is higher than ever, and yet we've had challenges in maintaining volunteers and continuity in operations in some cases. So, of course, please enter these conversations with that shared perspective, but know that food banks are in this for the long haul, and there's no doubt about our commitment to deepening partnerships between emergency food, clinics, and healthcare providers to address social determinants like food insecurity and create a healthier California for all. With that, let's go to the last slide where you can see my contact information. Here's how you get a hold of me. Here's my email address as well as my phone number. If you call that number and leave a message, I will not only get your message, but I will get an additional email notifying me of your contact, and I'll do my best to get back to you as soon as possible. Thank you again so much for your partnership with food banks, and I look forward to hearing from you soon.